Is it on camera?
That's gonna be your main camera, and that's gonna be my main camera.
Okay.
But they're streaming now. It's live stream.
It's a live stream. Oh, okay. Let me see how to
I like to be educated, but I'm so frustrated. Hello to my loneliness. I guess that ignorance is bliss. Take me back to before the new.
Hey guys, it's Dr. San, or Dr. Cassandra Parks Evans, and I am the owner of Let's Learn Love, and you have reached Let's Learn Love Live. And I have a fabulous guest. Oh my gosh, I'm so excited. As you see, I got tongue-tied. I was so excited. This is one of my girls right here. I love this woman right here. We'll tell you our story real quick. But this is Dr. Tosha Rogers. She is board certified OBGYN. She is board certified in menopause medicine. She's also board certified. I can't talk today. I'm so excited. Board certified in obesity medicine as well, guys. Of course, you've seen all the things about clean and cute panty wash, and for men now.
Yes,
there is a men's line as well. You've seen her Essence. You've seen her everywhere. Y'all, I'm so honored to have Dr. Tosha Rogers here.
Hey, girl.
Hey.
I miss you, girl.
I know, I miss you too.
I'm so excited to be here. Y'all don't even understand. This is my girl. I rocks with Dr. Sam.
Oh my.
So I'm super happy to be here. I'm wide open.
Oh
Let's
my
do it,
gosh,
girl.
I know. And you know, you just brought we was just talking offline, about our life and everything. Right. And we was just saying that how hard this week was. And I am so happy to see you. You brought so much joy to my heart just this week. And I want to thank you for that. We rock a long time.
Absolutely. It's been a minute.
Yes, we was just talking about that too. 18, 19.
Since 18 or 19, somewhere around there.
Yes.
It was definitely pre-COVID.
Yes, and we're going to talk about that too. You're starting it back up. But I actually met Dr. Tosha on her podcast. She asked me to be a guest, and we have been rocking literally ever since. I've been a guest of your podcast maybe three, four times.
Yeah, something like that.
And I've always, it was always been an honor and a pleasure. So I thank you. And I'm repaying the favor, so to say.
Thank you,
but we have a topic we're going to talk about today, which is really important, but we also want to know who you are. So after, everything and me being tongue-tied, tell us who Dr. Tosha is.
So that is not a very straightforward question. Yes, like Dr. Sand said, I am a board certified OBGYN. I own my own practice here in Atlanta. I'm not just about the whole papping and passing. I'm very much focused on women's health, guys. So, it's kind of anything. You come to me and you're my patient, baby. If it's dealing with your health, we're going to talk about it. Mental health, spiritual health, vaginal health, sexual health. I just kind of get into it all with my patients, which kind of led me into, when it comes to the menopause thing, everybody got this to say and that to say and the third thing to say. I'm like, I know it. I know the medicine of it, but baby, let me get some expertise in this so I can know what I'm doing for my ladies. And, us black women and jumping up on everybody's table to get this nipped and tucked and sucked. And I'm like, baby, let's get to the root of this problem. Let's fix this obesity. And me too, obesity is a disease. Y'all see Percy sitting here. I suffer with the disease too, but just because I don't follow my own program, I'm hard-headed and I'm lazy. But the point is, it's just that that's just who I am. I'm all about not just treating, not just, cashing somebody's check. For me, it really is about caring for women, especially black women, because it's so important.
Yes. So let's talk about your journey a little bit. I know you're a Philly girl, a proud
I
Philly
am
girl.
West Philly, yes, ma'am.
So, how did you come into being an OBGYN?
Oh, man, y'all, this has seemed like it really has seemed like a lifelong journey. And again, being from West Philly, as they would say, my family was from down the bottom, which is a part of West Philly. I had my smarts. I had my smarts. I went to a very magnet school, a very exclusive school in Philly. And I used that, and I springboarded that. I love my family to pieces, my extended family. They're a little questionable. They're a little crazy. But no offense, I guess it was a negative encouragement. I didn't want to be that. I didn't want to be 17 with a baby or two, calling somebody to bring Pampers, and I just didn't want that for myself. And it just became a thing. Interestingly enough, OBGYN was the last thing I wanted to do. Now, y'all gonna hear some ignorant, but I'm gonna be honest. When I was in training, I was like, listen, okay, when I went, every month you do a different specialty. Every 4 to 6 weeks you do a different specialty when you're training.
Right.
So when it came to OBGYN, my study partner always wanted to be an OBGYN. I never did. And so when I went in training, thank God I had sisters who were OBGYNs who were training me. And I said, listen, I'm not into this. This here is for lesbians. No disrespect to y'all. Y'all get into what y'all want to get into. I'm just here. Tell me what I need to do to pass. And I'm going to do that. And y'all ain't got to be worried about teaching me nothing. I want to know what's on the test, and then I'm done. They were like, good. But what you got to do is deliver a baby. That's one of the first things you got to do. So come in the room with us. It's going to be hand over hand. I said, what you mean? We're going to deliver. You're going to put your hands on top of our hands so you can feel what it feels like, but you don't get to cause any harm. Okay, cool. That sounds just like my thing right there. I don't know what happened. I got in there. I delivered that first baby. Something in that room changed. The energy changed. The energy shifted. That thing was spiritual. You could feel it. And from then on, I was like, I don't know what it was, but I liked it. And I would get there early. I would stay late. I wanted to see everything. I wanted to do everything. So I didn't really find it. It found me.
That's awesome.
Yeah.
And, that goes back to showing, the care that you have for women and, the love that you have for us because, you can feel it. Guys, if you don't have a quote unquote, home to go to, please go see her and her crew. Her doctors, they're wonderful. Her nurses, her staff, everybody that works with Dr. Tosha has to have a standard, and she sets the standard. So you just feel that with everybody, and you can tell. And I personally know, and I have sent people that when people were like, hey, I'm pregnant, I'd be like, hey, you need to go over to Atlanta premiere, and that was my thing. And I will always rock with you because of your love that you show for that. For sure. Now we go forward. How do we get our own practice?
How do we get our own practice? Again, same way. I guess, okay, I'm going to say something that may be a little bit taboo, but it's the straight up truth. They generally put, can I curse? They generally put pretty shitty doctors in our communities that tell us things that may be true, may not be true. A lot of the burden is placed on us. They don't tell us how to improve. They just tell us that we need to improve. And so in working in the community, because that's where I'm most comfortable, I can't be anywhere. I got to be pretentious. I don't like pretentious people. I'm not pretentious. I don't like it. I like being in the trenches with my folks. And with me sitting and talking and trying to educate, and they're like, come on, Rogers, come on, Rogers, come on. And I'm like, yo, this lady's in here crying. What you want me to be like? All right, well, that's enough for your visit. I got to go. I'm like, no. And so being with that and wanting to educate and wanting to teach people how to do it the right way and wanting to answer questions so that you can learn and do it the right way and stop doing the wrong thing and then get frustrated by coming in to get treated and nobody's teaching you better. It takes time sometimes, and they weren't willing to give me that. Come on, 30 patients on this schedule. You're taking too long. And I'm like, first of all, who you talking to? Second of all, I'm not doing this. So I got my own practice, which is a curse, a blessing and a curse. But it was a desire to do it the right way and to do it the way I wanted to do it. And so that's why.
Okay. So we're doing all this, and what does your practice entail? What have you grown it to?
So
all the little entities.
Okay. So that's a great question, and I'm so excited to talk about it because I literally get cheesed about it. The practice has evolved over time. Unfortunately, I do not deliver babies anymore, and the reason for that is very, very clear. I'm a control freak. I'm very possessive over my patients. I don't play about it. to God be the glory. I had 7,000 deliveries and no fatalities. And that's because I'm super anal and I'm super controlling.
Yes.
We are in a climate where the younger doctors don't want to be corrected. You can't correct a nurse because we have a nursing shortage. So if somebody gets mad and threatens to quit, then you're in trouble. And it got to a point where there were so many variables that I could not control. I said, if I can't do it safely, I won't do it at all. So I stopped delivering babies and really just focused on all around women's care. And I started to realize a lot of the problems that we have, a lot of the female issues, a lot of the sexual issues, the vaginal issues, a lot of that is centered around our, like, how we think about ourselves, how we take care of ourselves, our hygiene, our diet, and the hygiene of the men that we sleep with is a big deal too.
Very much
and
so.
we just let a lot of stuff just go just to say he's present. And I'm like, girl, do you, but we need to talk. So, and that's basically, so I kind of hit everything, the gynecology of it. I specialize in vaginitis and recurrent vaginitis that people can't seem to shake. I specialize in medicine for women over 40. Specialize in obesity medicine, meaning you ain't coming just to get a shot or just to get pills. We're not doing that. You get an exercise prescription. You get a meal plan. I follow you every 5 weeks depending on what your needs are. And everybody's obese for a different reason.
Right.
Then depends on how I treat you. And I follow you every 5 weeks to see our progress and how we need to change. And it's not just about a number on the scale. Are we helping your pressure? Are we helping your risk of heart disease? Are we helping your risk of going into AFib? Like, how are we actually helping you? And that is where the practice is. Where can we help you? How can we help you? We have a network of other providers who look like us. Just like somebody has a sexual problem, I'm sending them doctor saying, hey, I got somebody who can help you. You ain't got no insurance, you got a plan. You got insurance, you got a plan. Whatever the case may be. If I have somebody suffers with severe depression, hey, I got somebody for you. You need a family doctor, I got somebody for you. And all of the people who I refer to are going to give great care like I give.
Yes.
It ain't just good enough to be a black doctor. You got to be a good black doctor.
Yes.
And so that's how it's just kind of like I'm the hub. And I love that and appreciate that. And that I'm now seeing kids who I delivered back for birth control pills and for period control. I'm seeing moms, I'm seeing aunties, I'm seeing grandmas. So it just shows me that that thing we have in our community where it's like generational. Big mama is, you gonna listen to Big Mama, who gonna listen to this? It's coming full swing at the practice, and I'm just so proud of that.
Yes, you should be. You built hopefully you built an empire.
Hopefully, girl. From your mouth to God's ears.
Yes, hopefully you built an empire because, like the different facets of medicine that you do care for the women, and we need all those pockets because we need the obesity, knowing how we need to eat, what we need to do. We need the good vaginal, which we're going to talk about shortly, good vaginal care, because we want kids. We want to make sure our fallopian tubes are not scarred from diseases. We need that information, and we also need that little pep talk. Hey girl, it's okay, for you to have sex, but you need to do it responsibly.
Period.
So I know you're a great prep and HIV advocate,
Right.
and matter of fact, I asked you to come last week, and that's what you were doing. So we just want to make sure that the community as a whole understands your purpose and how great it is needed. Unfortunately, the whole story about delivering children safely, we know about that incident. I'm not going to ask you about that at all. But to let you know how close home that was the doctor that delivered my last son.
Wow.
So when I heard that name, I was like, wait, what?
So, and to let you know how close to home it was for me, not medically, the attorney who's representing them, right? I delivered his sister's child. I did not know who he was. He was in the delivery room.
Wow.
She never told me who he was, though. And so I came in. I was like, we're done. I don't like it. The baby does not look good. We need to proceed. We're done. I love you. And she's like a friend of mine outside of being my patient, because
Right.
she was like a coach somewhere, and I would speak to her team. I said, I love you to pieces. I know we wanted to do the kumbaya, have a baby by candlelight, next baby. But this one, we got to go to the operating room. We're done. I was like, anybody have any questions? I'll explain everything when we're done. And they were like, no. And so thank God. So she didn't tell me until this case came up. And she's like, well, you know, that's my brother. She's like, you don't remember him in the delivery room? I was like, no. But I'm saying to myself, but thanks for setting me up, sis.
Right.
But anyway, so yeah. So I have so many mixed feelings and so many mixed emotions about that case. What I can say is I feel bad for everybody involved.
Right.
No matter how egregious the act was, and I ain't defending sis by any stretch of the imagination, because literally in medicine we've never seen anything like it. I don't ever think there's been a documented case like that, right? But nothing can convince me that sister came to the hospital and set out to kill a baby that morning. She did not. I think incidents happened and things snowballed and things got out of control, and by the end of the day it was like, what the hell just happened? But you got to be honest.
Yeah, and you're right. You know, we need to show mercy to everybody in the situation. You know, it's a lot that went on with that.
Yeah.
And personally, like I said, I've had her as a doctor. You know, I never can say that I had bad care.
Right.
You know, it was a running joke though that she wasn't gonna tie my tubes. That was a running joke. But you know, other than that though, you know, she bedside manner, you know, all the things. It wasn't a bad experience for me, and unfortunately, it was a bad experience for someone else. So.
Right.
Well, we are here to talk about good vaginal health.
Yes, honey.
So, besides, let's start with hygiene.
Okay. Now, ask me pointed stuff now, because that's way
Yes.
broader than you would think.
Yes. I'm just gonna ask a couple of questions.
Okay.
Should we be putting anything in our vaginal cavity?
No. So here's the deal. When it comes to vaginal health, less is more. If y'all don't take anything from what I'm saying, less is more. Please hear me, ladies. Less is more. Nothing goes inside of the vagina. It is for fingers, dildos, tampons, and penises. That is all that should be going inside of the vagina. It's fine. Leave it be. Let it do what it do. It don't need your help. I promise you it does not. Okay? Take care of the outside. The inside does not need your help unless you do some foolishness, and then you can't even help it. I have to help it.
Right.
And that's one thing that is a big deal for me. Okay, I don't want to get off topic, because you know I can spin all
That's
around
okay.
with this. So I'm gonna just answer the question that you asked. So no, nothing goes in the vagina.
Okay, so you tapping on what you just said, take care of the outside too. What does the outside, taking care of the outside, the lips, the labia, all of those look like?
Okay, so let me just drop back a little bit.
Okay.
So when we talk about vaginal hygiene cannot be excluded from the remainder of the body. Like I said, recurrent vaginitis is my jam, is what I do. People come from all over the country for me to fix their vaginitis, okay? Now, y'all get a pen, because I'm about to give y'all $1 million worth of game for free.
Ooh.
Y'all about to get a visit with Dr. Rogers for free, okay? So get your pen, get your paper, get it all out. First of all, there are 6 different types of vaginitis, okay? I can tell based on the type of vaginitis actually how you got it. I really can. But it is not cut and dry. Most doctors' offices are only checking for 1 or 2 types. The problem is the medication that most people get for vaginitis, which is going to be your Metrogel or your metronidazole, it has a 30% failure rate, okay? And why does it have a failure rate? Because of the 6 different types of vaginitis, it only kills 4. But if your doctor is not checking for all 6, how will you know which ones you have and what you don't have? So a lot of people think they have recurrent vaginitis when actually what they have is untreated vaginitis. Let's be clear. It ain't that you've been getting it for 8 years. It's just that the habits that you have are perpetuating it and you're not treating it. So what does that mean? So the number one, well, not the number one, but one of the causes of vaginitis is medication failure. Okay? The next cause is hygiene. Hygiene, hygiene, hygiene. If I can fix this in women, I can fix 90% of the vaginitis. Y'all got it? Here are the rules, and I'm going to say it just how I say it in my office. Never shampoo your hair in the shower. Never use liquid soap of any kind. I don't care who made it. I don't care if it's made with the tears of sweet baby Jesus. If it is I don't care how organic you think it is. Somebody got it from the rocks over in Somalia down by the Garden of Eden. Baby, if it is liquid soap, it is going to give you vaginitis. And I'll tell you why in a second. No perfume soap, no deodorant soap, no Summer's Eve, no Vagisil, no baby wipes, no honey pot. There are only 2 soaps that I recommend, and it's 2 because I'm not self-serving. The first soap that I would always tell people for the last 15 years is Dove White Bar Soap, the original, the OG, on your whole body. Not the sensitive skin, not the exfoliating, the original, okay? That's
bar.
The bar soap, never any liquid soap. And I was said that up until 2 years ago. Is it 2 years? Maybe a year ago, I created a soap. If you guys don't know, I have a line in which when patients come to me with these problems, because my undergrad degree is in chemistry, I go into the lab and I whip some ish up. Okay, so everybody wants something smell good. Everybody body wash. So I came up with something called a body wash bar because again, we can't do liquids, and I'll tell you why in a second. So it has like manula oil, calendula oil, aloe vera oil, and then it has a preservative that I make. So it kills all the bacteria on the skin. It prevents yeast, vaginitis. It helps with eczema, psoriasis. Men can use it. Anybody can use it. Athletes' feet. I mean, it is the sugar honey iced tea. I'm not saying it because I made it. I'm saying it because it's the shit. Also, and it's amazing and it smells great. Also, ladies, please stop sitting your tail in stuff. These essential oils, these bath bombs, and please stop soaking your tail in Epsom salt. It is salt. And then you can't wonder why your vagina not getting wet. You pickling and you literally jerkying. You literally are jerkying your coochie, and then you like, oh, I got the wop. No, you don't. You don't, sis. You don't have the wop. You soaking that in salt. Stop. Just stop.
You're preserving it.
You preserve. You understand what I'm trying to tell you? I'm like, you put a piece of chicken breast in some Epsom salt and come and get it in a day or two, see what it look like. Stop doing that to yourself. What y'all doing? So sometimes y'all be doing too much. Why can't you use liquid soap? I said I was going to get back to that, right? Because let me just explain. The chemist in me will tell you that the base, whenever you make any product, it comes with the base. Just like whenever you have any idea, it comes from a base, right?
Right.
So whenever you make any product, it comes from a base. The base for dog shampoo, laundry detergent, and body wash are the same. So low key, minus a couple chemicals here, a couple of tweaking here. What's the difference in you washing your body with body wash, dog shampoo, and Tide? It ain't really that much difference, and then y'all can't wonder why y'all keep getting vaginitis. Don't do that, sis. It ain't that serious. I know y'all want all these figs and twigs, and y'all want to burn candles in the shower. Y'all want all this damn experience, like this whole spa. Go to the damn spa. But don't do that to your vagina. Less is always more. And not, oh, I'm going to wash my coochie with Dove. No, you're going to wash your whole body. The whole body, the entire thing. Have you ever gotten in the shower and seen the water cut to the left and cut to the right and avoid your coochie? No. So anything you wash your body with, you wash your coochie with. So please just Dove White or either Body Wash Bar by Clean and Cute. Either one of those two. But please, if you can't afford it, you don't want to buy it, I really don't care. But Dove Bar Soap, the original, the OG, the white and navy blue box. Okay.
Why not ivory? You know, ivory is supposed to be.
Ivory is very strong in stripping. It's very strong in stripping. So haven't really, that's the old back in the day. It's just short of being having lied to it. Don't, it's just a little too much.
It's a little harsh.
A little harsh.
Okay. So what about waxing? Should we wax? Should we not wax? What is your feeling on
So I feel like waxing is a personal choice. Now, if you're going to wax, I do have a couple of recommendations, though. If you are partial to, you have really, really curly hair or partial to ingrowns, you should sugar. That helps. Sugaring is better with what do you call it, with ingrown hairs and curly hair.
Mm-hmm.
So for some African Americans, I personally felt like sugaring was more uncomfortable. I don't have problems with ingrown hairs, but I just wanted to try it and see what it was all about. It hurt like hell, but I also think waxing hurts like hell. So I just went on and got me the damn the what do you call it, the hair removal, the electrolysis. I just went on and got that because that's y'all okay with that? Good. Also, a couple of other things. When you wax, do it earlier in the day. I feel like later in the day they've had the wax machines on all day. The temperatures are a little too hot. They're like, oh, your skin lifted. No, your skin didn't lift. That's actually a first-degree burn. Just telling you. So I'm like, do it closer to earlier in the day when they first are turning on the machines, closer to when they're opening versus 4 or 5 o'clock. They've been on all day. And my personal recommendation, just as a source of courtesy, I tell people put a tampon in when you wax. One, they get in there, you don't have to worry about anything getting into your vagina. And then, discharge can be normal. It's not always abnormal.
Right.
And so you don't want to expose anybody to your discharge because why would you? So put the tampon in. Just let them know I'm not having a period. It's just a sanitation thing, a sanitary thing. And they'll appreciate that, I think.
Yeah. So let's talk about discharge. Different colors of the rainbow can happen sometimes. The green, the reds, the unfortunately blacks and
The blacks.
no, just kidding. But
It could be,
yes. But what should our discharge kind of? What is the range?
So people always ask, I got discharge. I'm like, tell me something else. So your vagina is a mucous membrane, just like you have wax in your ears, you have saliva in your mouth, you're going to have discharge in your vagina. The discharge varies depending on where you are in the menstrual cycle. Week 1 can look like a thing, you got the Elmer's glue looking stuff sometimes, and you kind of got the little, stuff you look like, you got the clear stuff that it varies. I tell people the key to discharge is this: if you have a lot of it, problematic. If it's anything other than your whites, your off-whites, maybe, a light yellow, okay. But if it's a whole lot of it where if you don't wear a panty liner, your panties are soaked, that's problematic. If it has any kind of an odor means infection. The vagina is like food. Would you eat food that smell bad? Right. So there we go. And so if it's a funny color, if it's one of those off colors, green or a deep yellow or a gray, or even like a black or a dark burgundy or different things like that, those are things that require attention.
Okay. So he talked about discharge and we know what to look for. What if we're, start to itching and burning and
Ooh, child.
because this happens to me a lot. People say, well, I get a lot of yeast infections after I use this this gel that we use. What kind of gel do you use? This lube. It's a flavored lube. Oh, it had glycerin in it? Yeah. Oh, parabens? Yeah.
So
Look.
my slogan is everything that itches ain't yeast. Let's be very, very clear. Okay. Yeast is yeast, meaning yeast is very characteristic. Yeast is, interestingly enough, doesn't always itch, but it can. Yeast, if it's going to have discharge, it's going to be a thick white discharge or it's going to be a green, thick and thin, runny discharge. But everything that itches ain't yeast. Now, one thing I can tell you guys is that most condom types I do not co-sign. The spermicide on a condom will give you vaginitis, and it will also make your vagina feel swollen and itchy, and it'll make it feel like you have cuts. And there people are like, oh, that's how I be feeling after I had sex with him. Or I thought I was allergic to latex. No, it's the lubricant on a condom, which is 9 times out of 10, the Noxenol 9, which, if that condom breaks, actually makes it easier for you to contract HIV. So a lot of women tend to feel like either they're allergic to latex condoms, or this is just what happens after sex. And that is not true. That is a reaction to the spermicide. I'm not getting paid for this, although I should be, and I hope they seeing it. The only condom company that I actually will co-sign is a condom company called B Condom Company. They're a black-owned condom company. They have different sizes. They're at Target, Walmart, I guess, somewhere online. But B, the letter B, they're on Instagram, and B Condom Company. They're a safe condom brand to use. Also, herpes can actually present like yeast. The difference in herpes and yeast is herpes never has any associated discharge. But when women say, I get a yeast infection every month after my period, that's a red flag for me. I'm like, So, because oftentimes herpes can present like yeast. So,
Okay. So, have we had any advances in helping with herpes and the symptoms of herpes?
So, no. Well, okay. And I'm going to be very direct and say no. But I will say it in the spirit of a lot of people don't truly understand herpes, right? What you see on Google and on those are people who are immune compromised. Those are people who may have full-blown AIDS or HIV. Those are people who may be in chemotherapy. Those are people whose immune systems are compromised. First of all, the transmission rate of herpes is only 5%. So it does not mean that every person you sleep with, you're going to give herpes to. That is not true. The symptoms of herpes are very, very subtle. It can look like a hair bump. It can feel like cuts down there. Like you can't really see the cuts. They're in the grooves. But when you pee, you're like, well, it's stinging a little bit. And it's always a reason. You're like, oh, I got this hair bump. I did just shave. And you watch it. But if you do absolutely nothing, the symptoms go away in 3 to 5 days, mostly 5 days, if you do absolutely nothing. So in our mind, if it goes away, we good, right? So the thing is that when it comes to herpes, if you are truly getting flares every month, if you are, seeing things constantly, you're constantly getting outbreaks, something is wrong. And those people, I would say, hey, you need to be on some medication for, I'll usually say like 3 months, and then let's stop it and see what happens, because you're only really going to have an outbreak if you're stressed, if you yourself are sick. Whenever your immune system have to focus on keeping you alive, it don't care nothing about the herpes, because herpes is only skin deep. So it's going to come and go in 5 days. It doesn't really matter. Nobody really cares that much about it. And I really counsel my patients sometimes. I counsel them on when to discuss it, because always is not the answer.
So when is the appropriate time to
Discuss it.
discuss it?
Okay. So women are infamous for wanting to fall on the sword. Full disclosure. But y'all don't have no disclosure. I will say, when's the last time you saw your partner's testing? Never. But then you want to go home and say, well, my doctor told me I had herpes. Well, after 6 weeks, herpes is going to pop up in your bloodstream. So you don't know whether he had it when he met you, whether you had it before him, who gave it to who, you don't know. But if you go home with that diagnosis, then it's your diagnosis. Because we're going to say, well, I'm going to get tested. Well, hell, he'll likely be positive. But he's going to assume you gave it to him. Why? So my thing is, if you didn't have the wherewithal to say to your partner, I need to see your testing, before you started having sex, discuss it for what? First of all, it's skin deep, right? And so, like I said, it ain't like it's hepatitis, HIV, because they come to me saying, did you tell her? Yep, I told her, and I told her to tell him. She ain't telling me, lock up. But for herpes, this story is different because, again, we can't quantify it. That's why when that girl tried to come at Usher, I wanted to slap her. First of all, sis, and the sad part about herpes is this. 99% of providers don't check for it. Even people who do pregnancies, and it can actually hurt a baby if you deliver through that.
Right.
99% of people, the providers don't check for it. So when you come across somebody like me and I find it, I tell them, I don't know whether it's been there for 6 weeks, 6 months, or 16 years. I don't know. So don't go home and do nothing different, because it could have been there before you even met your husband of 10 years. I don't know.
Right.
You don't know whether he gave it to you, whether you gave it to you. Don't know. So it's difficult to try and have full disclosure in the middle of a situation.
Right.
So I'm like, if you don't know what the starting point was. Now, if you sleeping with somebody, y'all done got testing, you see he's herpes negative and you know you're positive, then I think it's the courteous thing to say, hey, listen, this is what I have, and give them the right to decide whether they want to be a part of the situation or not. But if you don't know, and we finding out in the 25th hour, baby, what full disclosure where?
It doesn't matter
It
at this
doesn't
point.
matter at that
right.
point. That's what I'm saying. So don't fall on the sword because it's gonna come up in an argument. You lucky I stayed anyway. You know you having herpes and all. And bro, you could have been the one who gave it to me. Don't try me like that. So this is why I say sometimes I'm like, depending on the relationship you're in, depending on who you with, and depending on where you are, decide whether it's something you should discuss. Because always ain't the answer. So.
Very true. Very true. So we're moving along. We kind of touched on some STIs and STDs. Will this is a common question. Will our vaginal area feel any different if we come in contact with HIV virus?
That's a great question, and the answer is no. No, it's a virus. So here's what happened, and y'all don't get me on my HIV prevention soapbox. But here's what happens. If you come into contact with somebody who happens to be infected with HIV, and obviously if they're HIV and undetectable, we don't want you having unprotected sex, but you can't transmit it to somebody if you're undetectable. You cannot, right? But let's say that person is not undetectable. Maybe they don't know they have it. And your body has 72 hours before you start reproducing the virus yourself. And this is why we say if you're having sex with somebody, if the condom breaks, it's a one-night stand, it's a jump off, you were drunk, you wake up and you like, oh my God. We say get to a PrEP clinic, and PrEP is pre-exposure prophylaxis, but we also have PEP, which is post-exposure. So before those 72 hours, you can get in and start a medication that you'll take once a day. And it will prevent you from getting HIV by 98.8%. And so it doesn't introduce HIV into your body. That's what everybody thinks. No, it prevents your body from making copies. Because after 72 hours, it starts making copies. And once it starts making copies, you're HIV positive. So we can prevent that from happening before that 72 hours. But you don't feel nothing. Feel the same. The bust down is the bust down.
You may be sore from the night before.
Right, but you ain't going to feel like, ooh, it's burning. I think he gave me HIV. No, ma'am. No, ma'am.
So we move along, and, now we're in a relationship, and we're at an age where we're at the end of, we're getting seasoned now. So we're talking about after 40 and after 50. Okay. What are we looking like? What are some things that we need to be doing?
So one of the things that you're going to naturally, which really plays on the self-esteem of women, is our libido naturally decreases. So we're looking at decreased libido. We're also looking at decreased vaginal wetness. There is certainly a way to deal with that. It is hormonal, but we have natural hormones now that are more bioidentical, meaning you come in, we draw your blood, we see where you are. We ask you questions like, how do you feel about this? What are your habits with this? Have you had this medical problem? Have you had this surgery? Whatever the case may be, we put your numbers into a program in the computer, and it spits out and tells us what you need. The good part about bioidentical hormones is that they're not cancer causing, they're cancer preventative. It helps with weight loss. It helps with mood, anxiety, depression. Honey, it turns that libido back to a 28-year-old baby. You be wanting to have sex with his man, her man, the FedEx man, the public sub man, baby. It is the turn up. Instead of taking 10 minutes to get wet, it takes you 2 or 3. You could be at work and be like, I wonder where this man is. It is a game changer. You rest better. It takes away your night sweats and your hot flashes. You're more at peace. You're more calm. You see situations differently. It's just an all-around game changer. And, women 40 and over, it's definitely something to talk about and consider.
Awesome. Where can they find you, Dr. Tosha?
Oh, I'm everywhere. So on Instagram, I'm Dr. Tosha Rogers. I'm at drtosharogers.com. The name of my practice is Atlanta Premier Wellness. And I think that's all the handles I know.
And you're moving.
I'm moving. I was down in Cabbagetown, close to, I guess, Glenwood Park, Reynoldstown, and we're now moving. Y'all know what Tower Liquor Store is off Piedmont. We're around the corner from there in the Buckhead area. And so actually, if you follow my Instagram, we're having a sip and see soon, so you guys can see the new practice. Yes. So you can come out, meet me, see where we are, see the practice, learn about the services that we offer, and we'd love for you to join our family.
Yes. Of course, I'll be there.
You better, girl.
Yes, I try to come to all your openings. Thank you so much.
My pleasure. It's my pleasure. I'm so glad to be here, girl.
We have to come back because you have to talk about menopause with me.
Oh, yeah,
you know,
absolutely.
we got to talk about my book. You know, the book "Fucking After 50."
I love it. I love it. You are so crazy. Like, I love it.
I know. That's why we get along so well.
You a
But
mess.
thank you so much again
Absolutely.
for coming. Guys, you know, this has been a jewel of a show. If you don't follow me, please follow me in all my handles. Follow Evan Vision, of course. Make sure that you follow our family as well. And, quick thing. I am having a workshop seminar the second Tuesday of April. So make sure that you check that out. It's sensational. It's making your own pheromone fragrance. So,
Okay.
yes. So again, thank you for being here. Thank you for joining us. And until next time, guys, we will see you soon. Love
Bye,
and
y'all.
blessings.